So my name is Dr. Daniel Leonard. I'm a board-certified pediatrician in Hastings, Nebraska, working at the Children Adolescent Clinic and Mary Lanning Healthcare. So last week, third week of June, we had a great milestone come to us through the course of this pandemic. Long-awaited vaccination for infants ages 6 months and over was approved for the FDA EUA, or Emergency Use Authorization. This has been several years in the making since the inception of the pandemic, when we were identifying high-risk groups being the very old, the immunocompromised, and the very young. Naturally, through the course of research, vaccination in particular, pregnant women and children tend to be the last group of people who are authorized or approved to use a product, the vaccine for COVID-19 in this case. We have to capitalize and maximize the safety of a product, of a vaccine, of a medication. Regardless of the benefit, the safety must outweigh that, and we've done a phenomenal job. All the medical scientists, all the researchers working on this, the health departments, so many players in getting this to the public to be available and safe. And I can't underscore how safe this product is and how efficacious it can be and needs to be in order to get us through to better times and make the pandemic part of history books. I have also been working as a medical scientist performing clinical research for both the Pfizer and the Moderna COVID vaccines for children ages 17 and younger. I've had every cohort, every age group, and we have had people from all over the country, literally all over the country, drive to Hastings, Nebraska here to be part of that trial. There are about a dozen physicians for Meridian Clinical Research who I work with, who all combined our data, pooled our data, had routine audits from vaccine sponsors, FDA, making sure that all lines were crossed, all I's were dotted, and again, the priority being the safety of what we were doing. Were the subjects in the study responding appropriately to the vaccine, and were they doing so in a safe way that really had very few side effects? And the overwhelming answer, fortunately, obviously, has been yes. That shouldn't be a surprise in pediatric medicine. We all know that childhood vaccines are very common before your 5th birthday. We take advantage of a child's innate immune system to maximize our vaccine benefits. And if you have a young child, you probably remember in their first year of life, they've had several vaccine series. So the need for multiple doses of one vaccine is not new to healthcare. It's pretty standard practice for most of these diseases we're trying to prevent. Obviously, both the Pfizer and the Moderna products fall in line with that. The Moderna series being a 2-shot series, about 4 weeks apart, and the Pfizer series being a 3-shot series. It's important to remember both products are incredibly safe and very effective, particularly at preventing hospitalization, severe disease, and death. So I had been asked through the course of the pandemic since the beginning, will a vaccine be available? If so, when will it be available? How is it going to work? I think those questions have been answered and can continue to be answered. And the second most common thing I'm asked is about side effects. What can I expect my child to experience by getting vaccinated? And fortunately, the overwhelming answer, more often than not, is don't expect very much. Most of the kids in the studies, particularly the younger age groups, the infants and the toddlers, experienced very few, if any, side effects. And certainly nothing that was severe, nothing that required accessing healthcare or hospitalization. They were completely in line with the typical vaccine reactions we expect that children have to every other vaccine they receive. Injection site soreness or redness, a little bit of fever, a little bit of fatigue, maybe some chills. These are inconvenient at most. They're not debilitating, they don't knock people or children out for days at a time. And they are a very acceptable price to pay for an otherwise incredibly safe and very efficacious vaccine. So, nothing in life comes for free, and if the cost is a little achy arm and some soreness for a day or two, that is well worth the price of preventing severe disease, death, or hospitalization from COVID-19 in children. A lot of parents ask me to justify vaccinating children for COVID-19 when historically, and only by historically I mean only a couple of years, we have not seen as severe acute disease or death in children, thank God. What I remind those parents of is the unforeseen, unanticipated long-term effects of COVID via natural disease and wild-type infection. And we're starting to see that clinically. It is at least one day a week I take care of a patient in clinic who has had COVID either a couple months ago, a year ago, and now we're dealing with the fallout of that. Reactive airway disease or childhood asthma. I'm seeing elevated liver enzymes and abnormal liver function testing in children. We're seeing immune suppression with decreased white blood cell count and a decreased propensity for fighting every other infection. And, we don't have a causative reason for this yet, but we're still looking into it. At the height of the pandemic, everyone was concerned with this multi-system inflammatory process in children, which was terrible. But now we're starting to see the fallout of what happens later on if you get wild-type COVID. What I really want to underscore for parents is that this is our knowledge of something occurring later, a long-term side effect from acquiring a disease is not new. In the 1930s, we identified the mumps virus. We recognized what the clinical symptoms were. We had a good idea on how to prevent it. It wasn't until about a decade later that we looked back and saw that nearly a third of males who had mumps as toddlers were rendered sterile as adults. That took a decade to discover. Let's not let another decade go by before we determine the importance and the necessity of vaccinating children to prevent wild-type disease altogether, if not for acute illness, for the long-term effects. This was replicated in the 60s with RSV. We now know, since second half of 20th century, that people who acquire RSV before their second birthday, nearly a third end up with childhood asthma. Take a survey of parents in a classroom. Probably half of them are going to raise their hands and say that their kid had RSV and that they dealt with one problem or another thereafter. So we have history, we have data, we have precedent for this, and we have reason to be worried about how this new novel virus might lead to long-term effects. And it is our duty, it is our responsibility to children to prevent that from happening and not have a cohort of kids who serve as an example to convince the other people to vaccinate. So when asked about when a child should get vaccinated, should they rush to their physician and do it immediately? Should they wait until their next well child check? The simple answer is the sooner the better. You can be concomitantly vaccinated for the COVID vaccine series along with other routine childhood vaccinations. There is no contraindication to that. You can be vaccinated if you have had prior COVID disease from wild-type virus. In fact, people who have had wild-type disease and then are subsequently vaccinated demonstrate exceptional immune response and exceptionally high protective antibodies for a longer period of time than those who just rely on their wild-type infection immunity, which we know does wane after several months. So now that it is available, it should be far more of a priority for parents to get their children vaccinated than it is get their groceries done, get the kids to camp, go on your vacation. Do all of those things, but do them all knowing that you have taken every opportunity now available to you to reduce risk and mitigate the chances of your child developing serious acute illness or long-term unforeseen side effects that we'll just have to deal with.